During the majority of my fellowship and during my early years on faculty at Sloan-Kettering, I've been focusing on the clinical development of new therapies for cancer patients with a focus on patients with melanoma and sarcoma. This is a really exciting time for cancer research. Our understanding of the molecular biology of cancer is increasing so rapidly, and that's leading to new therapeutic strategies and new therapeutic agents that I think a lot of us think will really improve the lives of our patients significantly in the hopefully not too distant future. In 2008, I received an ASCO Young Investigators Award, and I received that during my first year on faculty at Sloan-Kettering. I've received a Career Development Award as well. I think the impact of these awards on my career really cannot be overstated. Without this grant support, I wouldn't have the time to make the collaborations, interact with the scientists, interact with the statisticians, make the clinical trials that I'm running now, analyze the data. So without the support, none of that would have been possible. One of the things that I think is becoming increasingly clear is that when we're talking about, let's say, melanoma, this isn't one disease entity. It's a heterogeneous group of diseases. There's increasing evidence that each of these subtypes probably have to be treated differently. And so the work that was funded by the ASCO YIA actually tested the hypothesis of whether one particular treatment strategy would work in a molecularly selected patient population with melanoma. And interestingly, we've tested this sort of therapeutic strategy in an unselected patient population of melanoma, and that treatment didn't work. And yet, in work that I presented last year at the ASCO annual meeting, we demonstrated that we can get durable objective responses if we select the patients properly. And so I think what our work showed, or what it provided, is a sort of proof of principle that certain treatments will work in certain patients, and we might be able to select those patients prospectively using molecular markers. So the CDA actually builds on the same work that I've been doing with the YIA, and so what I'm doing with this new award is investigating a new sort of treatment strategy in a different molecular subset of melanoma. We're still going along the same theme of personalized medicine. For me, I think it's been absolutely critical to do the best I can to foster a very strong mentor-mentee relationship, and also do what I can to network, establish collaborations, and new areas of research interests. Clearly, the list of past recipients of this award have really gone on and made important contributions in cancer research, and a lot of their work, I'm sure in part, were dependent upon their support from the ASCO Grants program. So this program is really essential in cultivating the next generation of cancer researchers.